Hey, good morning, everyone. Good morning to the lecturers and all the students. Welcome back after the short semester break, recess. Before we start, I would like to just welcome our new tutor, Sibonello. For those of you on the WhatsApp group, I've already added Sibonello to the group. I would like to welcome Sibonello. Sibonello, if you want to say 2 words. Want to say something? Introduce yourself.
Good morning, everyone. I hope everyone is good. Well, my name is Bonello Biela. I'm the new tutor. Yeah, that's it.
Welcome, Spanilo. Looking forward to working with you. I'm sure the students are excited. Thank you so much for joining today. Um, yeah, thank you, Spanilo. So today we start with lecture 7. Although this is lecture 7, it is based on new content for unit 5. And we continue with helping parents who have children with disabilities or special education needs, or what we can call SEN. So just to recap, in our last session, we looked at the importance of supporting parents in understanding their children's disabilities or difficulties. We also looked at the importance of explaining to parents the role of the school and how the school can support them in their children's difficulties. And we also looked at some strategies to support parents. And for assignment 3, you were required to design a home program, or more specifically, a game that could support your learners in, or your case child, with regards to the difficulty that they may be having. So today we will dive a little bit deeper into how to support children with disabilities or with special education needs. And Dr. Fari spoke about ADHD, which I will also be including in the slides. And we can also have other special education needs. So just to begin first, as you know, all your content you will find on Moodle. It will be all your Unit 5 content. So this is all the content that you will find on Moodle. And then what is the outcomes for today's lecture? You will be able to define special education needs, or SEN. You will understand the emotional experiences of parents following the identification of a special education need. And we will also look at to describe the remedial educator's role in supporting families. So you as a remedial educator, what role do you play? Which we did touch on previously, but we will expand on this in this session. Again, apply effective consultation and counseling skills, which we learned all the solution-focused counseling skills. We also learned about effective consultation, but now we're going to specifically apply it to when we're engaging with parents who have children who have special education needs, right? And we will also identify strategies that we can use to empower families. And of course, strategies that we can use to strengthen home school partnerships, which is ultimately what we need to do. So the first thing will be, what are special educational needs of SEN? So this refers to children who may require additional educational support because they are experiencing barriers to learning. And these barriers that children might be experiencing cannot be addressed in ordinary schools or with this instruction in the mainstream school. So, for example, we may categorize these children as children that have learning disabilities, children with autism spectrum disorder or ASD, children with attention deficit hyperactivity disorder or ADHD, as Dr. Jean spoke about this morning, intellectual disabilities, hearing or visual impairments, physical disabilities, speech and language disorders, as Dr. Melissa so eloquently spoke about this morning and comprehensively spoke about language disorders and difficulties in both expressive and receptive language. And then also children with emotional and behavioral difficulties, those with ODD and other behavioral issues. And then also often overlooked is also giftedness and where children require enrichment. So, in the spirit of um, working with children with Elson, it is always important for us to think about policy. And policy talks about inclusive education. And given that we're looking at children with SEN, we should always remember that inclusive education recognizes that every learner has the right to participate, irrespective of their learning disability, their race, socioeconomic status, and it is our responsibility to make sure that they are able to meaningfully engage in the learning process or be part of the classroom, irrespective of their disabilities in this case or their learning difficulties in this case. So if we look at just to touch on just a little bit as a reminder that we do have principles that guide us, and we can use the same principles to guide us when we are speaking to parents, when we are engaging with children with learning difficulties or special education needs. And these principles include that every child can learn. So remembering that every child can learn, that diversity is a strength. That's why we now use words such as neurodiversity, that we need to recognize as we have gone through Bronfenbrenner's bioecological systems theory, that barriers can also exist in the systems within which children are developing and not only within the children alone. And then also, most importantly for this module, to remember that support should always be collaborative between parents, teachers, and other stakeholders where required, and also to also remember that families are an essential part of these partnerships. Right. So in the context of South Africa, among other documents, we do have policies and legislation that guides us in these inclusive education practices. And for instance, we have the Constitution that guides us. We have Education White Paper 6 that guides us, and the CR's policy, which we know is what we use in our classrooms and often referred to as the Bible in the classroom. So the policy used for screening, identifying, assessing, and supporting learners. So we need to make sure that we're always going back to these guiding principles and these guiding policies and documents in working with parents as well. So just to give you a few moments to just reflect, and I just want you to think or imagine receiving unexpected news that your child has a significant learning difficulty, or you might know a family member, or you might just know of someone who got some unexpected news about their child's difficulties. So I want you to think about, just put yourself in that situation. And the goal for this is just to kind of get in a space where we can experience some kind of empathy, right? Because that's very important in our work to always be able to put ourselves in the shoes of others. And as we work with learners, and more importantly for the purpose of this module, we work with parents. It's very important for us to be able to just take a step back and sometimes put ourselves into the shoes of parents, right? So I want you to think about how might you feel if you got some expected news. And what type of support would you need in those moments when you do find out about your child's diagnosis, or even soon after that, right? So what support would you need? And then finally, how would you want professionals to communicate with you? So I'm going to give you a minute for the sake of time. and you can make some notes, just reflect on those three questions. Okay, continue. So, building on that, we're now going to dive into some answers to these questions, right? We're going to look at how parents might feel, because this is important for us to be able to empathize with parents, also to help us to understand needs. Extended to that, how parents would want professionals to communicate with them. Also, how parents want you to communicate these difficulties with them. So, if you look at a parent who finds going journey after the identifications, and many parents experience a lot of emotional adjustments, and some of these adjustments we can compare it to grief. Um, as grief is losing something that you had that was a big part of your life, that guided your thoughts, your expectations, your plans, your goals. And now you've lost something, and you now need to rethink or readjust yourself or readapt or adapt your life, given that you've lost this something, right? And common reactions that we see in parents. Sometimes you see shock. A lot of times we see denial. We parents feel they'll totally say, no, this is not what I'm seeing. I think I need a second opinion. And these are quite normal reactions. A lot of parents experience confusion. A lot of parents experience fear, because now they're scared what's going to happen next. What is the implications of this diagnosis? Some parents might even feel angry, sad, right? Then you get some people, God given, whatever their reasoning might be, in different contexts, cultures, you might find acceptance right away. And then in some parents, you'll see they might be hopeful and say, no, they're hoping for the best. They believe the best outcome. And another one, which is not added, sometimes it's closure for some parents. I've seen many parents say, oh, now I understand what's happening. Once the diagnosis is given and explained like Dr. Fudi explained this morning, all the symptoms that the parents have already been seen. They already know the difficulties the children have, but they just did not have a diagnosis. Or while we avoid labeling, but sometimes with a diagnosis and with an explanation for what's happening with the child, sometimes gives a lot of parents closure, because now they can say, oh, this is what's happening, this is the diagnosis, this is what I need to do going forward. But then again, parents will also ask a lot of questions, and these questions may be directed at you. So a lot of questions, some questions that you may find is, did I cause this, right? And this is common. For example, if parents maybe had some kind of injury or they were in an accident, or one that I've seen is if a parent has consumed alcohol or drugs in their pregnancy, or there may have been a premature birth or something. So parents, there might be a lot of guilt, and they might ask, is this because of something I did while I was pregnant, while I was, during the time? Sometimes there's even accidents that happen and parents blame themselves. So they will also ask questions like, will my child ever be independent? Um, a very big question that parents will ask, okay, what happens next, right? Some parents are not ready to look at what happens next, but some parents will ask, okay, what happens next now? What do I do, right? And then a very common one also, especially in intellectual disabilities, parents will ask, can my child be cured? Is there medication for it? What do I need to do? Will my child be able to stay in a mainstream school? If there's cases where children need to be placed in a special school. So these are very common reactions, and it's very important for us for you as remedial therapists or remedial educators to denormalize these emotions, right? And to also expect it, and to be able to put yourself in the shoes of parents, because it's a very big shock to parents, right? So given that parents will go through these difficulties, we might see different challenges in different domains, right? Some parents might have experience emotional challenges, anxiety, depression, stress, burnout. I've often seen parents who already come with children who have a autism diagnosis. You can see the burnout in them. Or sometimes even prior to a diagnosis, you can actually see the burnout because it's very challenging and difficult to care for a child with ASD. There might be other challenges, financial strain on the family, getting medical treatment, getting support, keeping up with appointments. A lot of time we find parents are going to BARA, they're going to speech therapists, they're being sent to Wits University for tests. So a lot of medical appointments, and in our context, sometimes parents struggle to travel from low socioeconomic areas to other areas to get this help, right? Even just to come to an assessment, sometimes it costs the parents financially, for financial strain to do that. Therapy costs if they're going privately for therapy, and even transport difficulties, having to take one or two or even three taxis just to get support, or to go for a test, or to go to the doctor or get medical treatment, and sitting for hours and then taking two or three taxis back home, right? Other difficulties that we may see parents experience is isolation. Huh? So sometimes when we have children with difficult behaviors, and those around them don't understand, they might say that the child has discipline problems. Parents are not addressing discipline issues, and this makes parents feel very isolated. In a lot of communities, parents experience stigma, especially prior to education, where we are now with inclusive education. Sometimes there's a lot of conflict between parents, even. I've seen where father wants the child to be assessed, mother doesn't want the child to be assessed, or mother accepts the diagnosis, father doesn't accept the diagnosis. So this creates a lot of conflict in families. And then very commonly, a lack of understanding in the community, right? So for us to understand parents' grief, we need to remember that parents are not grieving the child. They are grieving the loss of the expectations they had for their child. For instance, a common question parents will say, so does this mean that my child will not complete matric, for example? Or what does it mean if my child needs to be placed in a special education, in a special school? What does that mean? Does my child, will my child repeat the grade that they are now in? So it's a real, if you can say, a shock to their expectations for the child. They might have thought my child will be academically strong, they'll finish school, they'll go to university. So they're grieving all these expectations. And if we look at grief, for instance, we know that grief is not a linear experience. It's non-linear. It is ongoing, and it is especially triggered by developmental milestones. And let's say, for instance, the child is, for instance, 5 years old or 6 years old when they get a diagnosis. At every stage of the development, new challenges will arise. And then parents will grieve the expectations they had for the child at every developmental stage. Like Dr. Fari said, ADHD in teenagers are different. So even though a child might get a diagnosis earlier, but when they get to teenage years, it might present in different ways. So parents are triggered at every stage of the child's development, and they now need to respond and adapt the expectations and adapt how the strategies that they're using and the support they may need. So it's important for us to remember that parents are grieving expectations and they're not grieving the child. Right. And then, as we know, we did Bronfman Brenner's family systems perspective. And what I've done here is just carve out only the microsystem, because I want you to focus today just on the impact that it has on the microsystem, right? So once a child gets a diagnosis, there can be different impacts on the microsystem. For example, the marital relationship sometimes becomes strained, right? Siblings often struggle because a lot of attention is given to the special child or special needs child. Um, Grandparents often come to the rescue and support of parents, and they also sometimes we have grandparents who even do not agree with diagnoses, right? And then we find extended family also feel that they have a say, depending on which cultures we are in. Sometimes extended family have their opinions about what's happened as well. And then also it affects the financial well-being, because now extra medical bills, extra bills for different services, especially the child needs speech therapy, occupational therapy, and maybe in the case of a child with ADHD, now they need medication also. And if the parents are not in the government hospital, they're going privately. And then, of course, the effect on parenting roles. What role does the mother play? What role does the father play in supporting one another, in supporting the family? So if we think about the microsystem, there's a lot that's happening there and a lot of influence between these systems and all the stakeholders in the system. And further, you can even look at from a cultural point, you can look at other adults in this microsystem, right? And teachers also fall in this microsystem, but I just want us to focus on the family for now, right? So why is this important to look very closely at the microsystem is because the remedial educators should work with the whole family system, right? Wherever there's support, you have to think about the father, you have to think about the mother, because sometimes fathers' roles are overlooked, or fathers' feelings, or the way it impacts them, because sometimes fathers are impacted differently, right? Fathers feel more responsible for the parent, for the family, so they may not know sometimes how to support the mother. So we have to look at the whole family when we working with these children, right? So now we can look at what are the common needs that research shows us, right? So because of this, there's been a huge interest in research to say, okay, what do parents need, right? And research has found that parents often, the number one need is they need accurate information. So a lot like Dr. Fari said this morning, you need to be able to explain to parents in the case of ADHD, what exactly is it? And be able to lay it out for them and explain everything to them and accurately be accurate in what you're saying, right? And for instance, say important things like what your role in this is, right? That is not your role to diagnose, but you do understand what the child's diagnosis is, right? And often parents want hope. They need you to extend that communication that provides them hope, to be empathetic, and to help them to develop this hope for their child, right? They also need emotional support. If they're feeling fearful, if they're feeling overwhelmed, they need that containment and for you to provide them that emotional support. And when it comes to practical advice, now we need to say we need to provide strategies for parents. What practical things can they do to support their children? And then also, parents need advocacy. So that is why this module is so important. Because in this module, we're speaking about parents, we're giving the voices to parents as well, to say that we need to advocate not only for the child, but also for the parent, right? They also need school collaboration, right? So that they don't feel isolated from the school once the child has a diagnosis. Uh, Research also shows that parents need access to services. So luckily for us, inclusive education has made great strides in making sure that children have access to services. For instance, within in special schools, like Dr. Furi said, we have nurses in special schools that can administer medication. We have occupational therapists and speech therapists at school to make it easy for children to access these supports rather than having to go to hospital or going privately. And then also parents often need community support, right? From those around them, whether it's their churches, whether it's centers, um, uh, advocacy or support groups, parents need to feel that there is a community for them, right? That's why it's so important for example, children to parents to join a group. Like if the child is diagnosed with autism, to access parenting groups that support one another with autism. And there's so many in South Africa. So, yeah, so those are all the expectations from parents and what the research shows. And as we know, we've already looked at counseling skills, right? And this is kind of just a review of what we've looked at. So just to again reiterate that it's important to actively listen to parents without making any judgment, reflecting their feelings and validating their emotions. Um, Also very important, help to educate parents, help them understand the diagnosis, look at it from a strengths approach, and also explaining to them what the child's learning needs will be once the diagnosis is made, and also to give them some information about what available interventions are there. So, for example, if a child has an expressive or receptive language challenge or a language developmental disorder, we can say to a parent, your child will need speech therapy, or where can the child access these interventions, right? And most importantly, um, to express empathy. For instance, telling parents things like, I can hear how overwhelming this has been for you. And to have little snippets of comments that you do make and you do think deeply about it, that you use in your repertoire, in your toolbox to help people, parents with overwhelm or when they're feeling, when they need this counseling support. Right? And then the next thing we need, which we have covered in previous modules, is to look at effective communication skills. So very helpful communication is to ask open-ended questions. And just to speak a little bit about our one of our second assignment, you were asked to design some open-ended questions instead of closed-ended questions like, what is your child, uh, what is your child's diagnosis? You can instead say, tell me about your child, which is more open-ended, right? Reflection. It sounds like you are feeling exhausted, right? So these are just examples of some of the phrases that you can use or some of the statements you can use. And then offering parents validation. Many parents experience these feelings. So using strengths-based language to say, normalize it and make them feel like they're not alone and they're not isolated. And then also when it comes to the child, to use strength-based language rather than deficit-based language. So instead of saying your child cannot do this or will not be able to do this or is unable to do this and will never be able to do this, you can say your child learns best when, for instance, we use pictures, or your child learns best when we remove distractions from a room, right? So being very selective about how you communicate with parents during these times or after these times, right? So now we're going to delve a little bit deeper into a strengths-based approach. Right? So again, rather than focusing on deficits, we identify strengths. And we not only identify the strengths in the parents, but we also identify the strengths in the children. For instance, um, if a child, we know that actually children with ADHD, they are very hyper focused. They have the ability to be hyper focused. Some of them are very creative. So also point to those strengths that the child might have. And you might have even a quick giggle with the parent when you speak about strengths, because parents will say, yes, my child actually is very good at drawing. Trying to move their attention also to the strengths of the child. When you say to parents, oh, your child's very curious, is your child very kind? And parents will say that, my child's very helpful, he's very kind, he's very friendly, he's always looking after his baby brother, right? And then you have some children who, despite their learning disabilities, they might have good memories or they might be autistic, right? You get some children who are funny. They tell jokes and parents just enjoy having a good conversation with them. So focus on the child's strengths, even though within that context of a diagnosis, we also try to draw the parents' attention and our attention also to the strengths within the child. And then strengths within the parents, you might witness parents are very committed and say to the parent, the fact that you're sitting here shows me that you're very committed, you know, and I can see that you love your child very much and you've thought about lots of ways to solve your child's problems and you are so resilient, right? And you can say these things to parents. And then when parents express their needs or they express what they want for their children or for themselves, and then encourage them to advocate and to ask for the children's needs. For example, if a parent asks, and I've heard parents ask, can my child have a scribe? Will my child qualify for a reader and a scribe or extra time? Those are parents advocating for their children, so encouraging them to advocate for their children's support needs and the services they might need, right? And asking questions to schools, asking questions at the hospital or when they're going for their medical checkups to tell them to ask the doctor, ask a lot of questions about what's happening. If they're not sure, if the medication is, for instance, making a child too drowsy, go back to the hospital and ask. I noticed my child's drowsy. I noticed my child's not eating well. So helping parents also to advocate and if parents are advocating, draw on that strength that they are able to do that, right? And then to remember that strengths build resilience for both parents and children. So we not only focus on the child's strengths, but we also focus on the parents' strengths. And then, of course, empowering parents by teaching advocacy skills, like I said now, asking for help, um, voicing their expectations, voicing their thoughts, and just having a voice for the child, right? Also important to explain to them what are the educational rights. For instance, saying to a child, to a parent, your child now has a right to go to a special school, or your child has a right to services like occupational therapy and so on. And very commonly also, I have heard a lot of parents ask, can my child get a social grant? So very important to tell parents, you do qualify for this, but this is the process that you need to go through because now there might be some financial strain. So telling parents that you do have these rights in a country like South Africa, especially, right? And then of course, a very big role for um, remedial educators is to encourage parents to be part of the decision making, what kind of intervention, what you'll be doing at home, what you'll be doing at school, making them part of this decision making. And then in so doing, we build parents' confidence that they're able to advocate for their child, that they can work with others, and they have a right to all the amenities and all the things that is provided within the system provided through inclusive education policies and other policies that we have in South Africa. And then also, we might not have all the solutions to all the problems that parents have, but we can sit with them and we can problem solve with them so that they know that they don't need to be alone and they can actually sit with us and discuss the problem and how are different ways. You might have some suggestion of a strategy that a parent can use it. I mean, a parent might tell you, I tried that, that doesn't help. And you're like, okay, what can we do instead of that? What do you think? Let's put our heads together and think about what we could do. And then also very importantly, to celebrate progress. When we see a child is achieving something, communicate it, communicate with the parents, communicate from school, sending something home in a notebook, like the teacher said this morning, sending something home to say that the child achieved this today. So celebrating those moments, right? So the goal here is to move parents from more of being dependent on others and feeling isolated and all the emotional and other domains of difficulties that we saw, and to instead empower parents, right? And then, as we know, the homeschool collaboration, effective partnerships between parents, teachers, and therapists, right? So, if you were the remedial therapist in your school, you would be that third level of support, working with teachers and then also working with parents, right? And then, what does school partnerships look like? What makes it successful? And one of the three or some of the things that the researchers found is that if you have shared goals, if there's regular communication between schools, teachers, remedial therapists, and other stakeholders, when there's respect between everyone, and also mutual trust. These are some of the characteristics that shows in research what is successful collaboration, right? So in our previous assignment, we looked at the home program. And I think Dr. Jean touched a little bit on different things you can do to support children with ADHD, but more just broad strategies that we can use that we can help parents with. And we do have specific strategies for specific to your case child, or specific to children with ADHD, or specific given the diagnosis. But some of the just basic and very gentle strategies that we can begin with, we can always tell parents to establish routines at home, right? Because children with ADHD and other ASD, they do very well when routines are established. There's predictability. They know what's coming next. Children with ASD, especially, they want to know what's happening. They don't like their routines to be changed or new people to come into their surroundings or the environment. They have a host of things that the minute their routine goes out, then they have tantrums or they have meltdowns. So one of the very first things you can, and even children with homework or reading difficulties, one of the very important things is to help parents to establish routines, right? And then also read together daily, which this is a challenge, but encouraging parents and supporting parents if that is not taking place, and also problem solving on how can we increase this or how can we improve these type of strategies. And then again, celebrating small successes, using visual aids as our speakers today's emphasized that using visual schedules really supports that learning because now we have these children are visual learners and children learn through different modalities, but a lot of younger children and children with difficulties with reading, sometimes visual schedules and pictures work better for them to just anchor their learning and to extend that learning so that they can have that visual representation to help the brain networks to make those connections between learning and then also encourage independence. Sometimes we find a lot of parents want to do everything for their children. So, for instance, tying their laces, rushing them out the door in the morning, packing their bags. So, very important to teach parents how to help the children to be independent, right? And then again, focus on strengths, which I've already spoken about, and also maintain realistic goals. A lot of the time, sometimes parents do have unrealistic goals, so sometimes we need to balance those goals and be clear and open and honest with parents that we can try this. Don't shut them down or um, not manage those expectations to say that we can see that your child is struggling with this, but let's try this and see how it goes. Let's see um, how your child develops and responds to these interventions or these strategies, right? And then very importantly, often overlooked is siblings. So we sometimes see, and I've actually seen this where the siblings of children with diagnoses or children that have difficulties, sometimes there's a lot of jealousy because they notice their parents giving their sibling more attention. Some children actually suffer under the burden of responsibility. You get sometimes older children have to look after the younger siblings who have disabilities. Sometimes you might even see children feeling a little bit embarrassed about their siblings, but it can be the other way around too, where children actually stand up for their siblings, right? And then you will see them having pride, and they will even advocate and be helping their siblings in any situation. They'll be they'll be helping them and assisting the parents to make it easier. And sometimes siblings also have confusion. Sometimes I've seen siblings coming with when there's feedback. And then all the siblings will, because they're supporting their parents and getting the feedback, they'll be confused. So just being aware of how a diagnosis can also impact the siblings of children with diagnoses, right? So very important for us to give age-appropriate information, giving siblings also opportunities to express their feelings and their thoughts about the diagnosis, and then encouraging parents to also give one-on-one time to the siblings and not only the child would always be consumed by the child's needs with a disability, right? And then sometimes parents are so focused on the achievements and the needs of their child with the diagnosis that they actually forget the achievements of their other children. And then these children actually don't get recognition for their achievements. So telling parents to also praise them and make them part of everything. For example, family discussions, emotional support, reassurance, and also opportunities to develop empathy. Sometimes we need to tell children this is what your sibling is feeling or thinking, or they're really having difficulty understanding you right now, or they're really upset now, just helping them to build that empathy. And then also where required, sometimes we will find that siblings act out and there's sometimes behavioral difficulties. So in that case, then support can also be sought for siblings and also support groups that can help with siblings to adjust to a diagnosis. Right? So remember that supporting siblings strengthens the well-being and resilience of the entire family. So it's also important to not forget the needs of the siblings and the other members of the family. Right? And then, of course, very importantly, to remember cultural and religious considerations that sometimes families understand disabilities very differently. Um, in fact, I must share, I spoke to a teacher the other day and she was explaining the difficulties a child was having. And when she spoke to the parent told her, okay, I understand the difficulties. I think I'm going to take my child to the local Sangoma. And then she was like, and I said to the parents, well, do that. And then you come back and tell us what the Sangoma said. So respectfully, she listened to the parent and she asked me what. I said, no, you did the right thing because we need to be sensitive about culture. We need to be sensitive about religion and what beliefs people have and just encourage them to also seek that help and that support from their communities and based on their cultures. Right? So very important for us to practice cultural humility. And if we do not understand the perspectives of a culture or religion, then we ask, respectfully, we ask, and show some curiosity. Yes, tell me about that. Oh, this is what you believe. This is how you deal with this. You know, being curious and trying not to make any judgments about religious or cultural beliefs and also not making any assumptions, right? And as we know, very importantly, um, when a child needs additional support, it's very important for us to refer when necessary. Dr. Fadi touched on this. So, educational psychological assessments, mental health counseling, family therapy where needed, parent support groups, financial assistance where needed, the social grants, social work services, occupational therapy, speech therapy, and other medical specialists. And then we're not going to go through the case study, but I've included a case study in the slides for today. And I just want you to have a look at it and think about um, the case study and also apply your mind to the questions that I'm asking there. So just something for you to extend your learning and apply it to case study. Case studies work very well in our knowledge. And then the take-home messages for today. Remember always that parents are experts on their child and that every family responds differently. Listen before advising. Focus on strengths of the parents and the children. Also, remember that collaboration improves outcomes for both parents and children. And also, when we empower parents and children, this leads to resilience, not within the family only, but within the community. And then just a few references. And then just to touch on um, our assignment, we are on assignment 4 now. Congratulations to everyone for submitting the assignments and managing with everything. I noticed that everyone uploaded their assignment 3, so now we will proceed to assignment 4. And I included this in today's slides because this assignment, although it's not the heavily weighted one, but there's a lot of writing that needs to, and thinking that, and research that needs to go into this assignment. So it's a critical essay, and you can go and read the details for this assignment and the maximum word for the 60,000 words. So you are going to write a critical essay discussing the importance of establishing effective parent-school partnerships. And you're going to do literature to guide your critical analysis, right? And then you also have a rubric, and the assignment is due on the 14th of September. And like I said, we are on assignment 4 now, and our next lecture will be on the 15th of August, and the next assignment is due on the 14th of September. And I conclude with these. Children can't see and live up to the best in themselves if we were always pointing out the worst. So again, from a strengths-based approach, always focus on the strengths of the parents, of the children, of the community. I thank you for listening, and any questions? I will stop sharing. Are there any questions?